Hello there, I'm Michelle. I bring you MBLEx resources both on YouTube, lots of videos, but on my website, in the link in the description and in the pinned comment below, you're going to find a huge list of ebooks, study guides, practice tests, and even courses for those of you who need to take a deeper dive into everything you need to know to pass the massage and bodywork licensing exam with calm and confidence. Today we're going to be talking about the urinary system. This is the 29th video in the Anatomy and Physiology series that I've been composing. Every time I produce another set of videos, I put them out on YouTube for you. They're going to continue to be here for you, but I'm also creating a whole course that's going to be on my website as well. So it's all going to be packaged together, so it's really easy to follow. There's also a PDF that goes along with each of these videos that you can find in the link in the description below, so you can print those up and have those as study guides, and they're going to be on the course as well. But today in the urinary system overview, we're going to be talking about the organs of the urinary system and the functions of the urinary system. That's really important to know for the MBLEx, is how the urinary system helps the body. Now, we're going to be talking about the kidneys and how they filter blood, and we're going to talk about body fluid management and urine formation when it comes to the whole body. And then at the very end, we're going to be going over practice questions so that you can know what kinds of questions you could possibly get on the MBLEx. Now, I'm not going to be talking about pathologies of the urinary system, and there are a handful of them, but that's going to be on my video that also covers the urinary system for pathologies. It's a general pathologies, and urinary system is packed in there, but I also have a whole course that's available for you for every pathologies for every body system listed through, and you can just follow those videos. So that is going to be linked in the description and the pinned comment below. So watch out for that, because I'm not talking about pathologies in this video. And yeah, so make sure and subscribe, make sure and like the video so that you can help other future massage therapists have access to this information. So without any further ado, let's do this. Urinary system.
Filtration, balance, and whole body health. The urinary system cleanses the blood of wastes, regulates fluid and electrolyte balance, and helps maintain blood pressure and pH, functions essential for homeostasis. For massage therapists and body workers, understanding this system is important for recognizing referred pain patterns, that is when someone's having kidney issues, modifying treatment when needed, and appreciating how stress reduction can improve kidney function and overall well-being. All right, so there's a couple different components, organs of the urinary system. We have the kidneys, those are the actual functional units. They're the organs that filter our blood and form the urine. And then we have the ureters, which carry the urine from the kidneys to the urinary bladder, which is urinary bladder down here is the temporary urine storage. And then we have the urethra, which is the pathway where the urine comes out. Functions of the urinary system, basically, it filters the blood of anything that we don't want in it, mostly nitrogen-based waste products, and also medications and toxins. It filters all of that out. And then also the function of the urinary system is that it regulates blood volume, blood pressure, electrolyte levels, and the pH of blood. And the electrolyte levels and blood pH go together, and then blood volume and blood pressure go together. So it regulates the fluid in our body, and it lets out the excess fluid so that we don't have too much, so our blood pressure doesn't go up too high. But a big thing that it does is keeps our blood pressure from going too low, because I'm going to explain this, but evolutionarily, it was more the case that we didn't have access to enough water, and so we have these mechanisms that help us to prevent dehydration. And then electrolytes, maintaining the base or acidity of our blood. That happens when we're filtering our electrolytes in the body. So also, eliminating wastes, producing hormones. We do have a couple of hormones that are produced in the kidneys, so we'll talk about that. Okay, so first we're going to start talking about the kidneys. So there are two of them, and they're about the size of a fist. So here we have in the image, I'm adding on in this video, I'm adding on the circulatory system to the kidneys so that you can see where the veins and the arteries enter the kidneys. And then let's see. They are retroperitoneal, which means that they're behind the peritoneum. Now, if you remember from the digestive system, or when we were talking about membranes, we were talking about the peritoneum being the bubble that protects the whole digestive system. Behind that bubble, there is another section. They just call it the retroperitoneal space. So it is in its own fascial sheet to keep it in place. The right kidney is a little bit lower than the left kidney because the liver is right above the kidney, so it needs more space. The liver needs more space. So that's why they're not quite parallel. The renal capsule, that's what it's called. The renal capsule is what protects the kidneys. That's what they call it. I didn't see it in here. It's not listed in here, but yeah, fat and fascia are what protect the kidneys. There's always something protecting an organ. What it looks like inside the kidneys. We have the renal cortex, which is the outer region, and then we have the renal medulla. Renal, whenever you see renal somewhere, you know that has to do with the kidneys. So renal cortex, which is the outside, and the renal medulla. Remember also when we're talking about the adrenal glands that sit on top of the kidneys, those have a cortex and a medulla as well. So that will help you keep that in your head about which anatomical part is which. And then there's the hilum, which is that's the center where the stuff comes in and out. So we've got the blood vessels that come in and out. There's arteries and veins, and then also the ureter exits out of that hilum. Renal pyramids. When we get into the renal medulla, we have the renal pyramid. It's almost like orange slices. So they're like pockets in the kidneys where the action happens. So let's take things back just a second. The nephron is the actual functional unit of the kidneys. That's where the filtration happens. And there's 1 million per kidney about of those that are all over in here. This is what a nephron looks like. That's the functional unit right there. It's so tiny. You can't see it in this image because there's 1 million of them. That's a lot. It starts out in the cortex, and then it branches down into the medulla, into that renal pyramid. So when the filtrate filters into the ducts and becomes urine, it collects down into these areas that are called calyxes, and then the renal pelvis is the center of the kidney, and then the fluid goes down the ureter. So it starts out by blood vessels being filtered, and then the filtrate comes down the duct, and all those ducts collect and collect and collect in the renal pyramids, and the fluid goes down through the calyxes into the renal pelvis and out the ureter. That's how it works. Important information for you as a manual therapist, that the kidneys do lie under the floating ribs on the back. They are deep. Let's look back here for a second. So they are deep inside the cavity, and they sit next to the spine. So considering the placement of that, when you are doing deep work in the mid to low back, around where the lowest ribs are, if you're not very, very careful, you could injure the kidneys. So that's why we try not to do deep pressure in that area 4 inches lateral to the spine, because we could potentially break a floating rib, which could puncture a kidney, which could cause all kinds of problems for that person, not to mention being very painful. But here's the thing, is that sometimes when there's kidney dysfunction, that pain can feel like low back pain. So someone's, I really need some deep massage in my low back because it hurts, or my mid back because it hurts so much. This is something to keep in mind when you're working on someone. It's like, well, I can't really use deep pressure there because I could injure you. Kidney stones, they feel like abdominal and back pain. So keep that in mind, that could be something that's going on with somebody. Ureters are the tubes that carry the urine from the kidneys down to the bladder for holding. They have smooth muscle, and so they move the urine through peristalsis. Remember, we talked about peristalsis? They are smooth muscle contractions that move fluid. So here's something interesting in this little video, that there isn't much to say about it besides that there is peristalsis happening in there, and there are mucous membranes lining the inside so that the urine doesn't damage the vessels. But look at the angle of where the ureters enter the bladder. We'll play this again. Check that out. It's the same thing with male bodies as it is with female bodies. The fluid enters from underneath. So what's interesting is that it has a one-way valve on that place where it attaches to the bladder, so that when the bladder becomes full and it's making little contractions to try to get you to go to the bathroom to release it, it doesn't backflow because of the angle. It only pushes in, it only pushes fluid in, and the valve will not open going back, or else there could be a lot of pain and possibly issues for that person. So that's really interesting. And then there's the bladder. It is, as we know, a temporary urine reservoir. So I've circled the urethral openings where the ureters are coming in and going in from underneath. There's a couple of layers here. There is a mucosal lining to keep the lining safe. So it makes mucus to keep the lining safe from urine damaging it. And then it has 3 layers of muscular lining. You don't really need to know any more detail than that except that it's a muscular lining that has 3 layers. It can hold up to 25 ounces or 3 cups in males, and because if female bodies have the uterus to contend with, and especially during pregnancy, the bladder can't hold as much. Only as much as 2 cups. But there are folds, just like in the stomach, there are folds in the lining called rugae that will unfold to make the bladder expand when it's necessary, when it's needed. And then there are 2 sphincters at the base of the bladder, and those are for holding in the urine. The internal urethral sphincter is made of smooth muscle, and there are stretch receptors inside of the bladder that will say, I'm full. And that triggers that internal sphincter to open. And that's when we're like, I gotta hold it. The external urethral sphincter is made of skeletal muscle, which we can voluntarily control, hopefully. Not always. After we've had a few babies, it can get a little bit harder. But yeah, so there's a sequence of events that happens. First, the stretch receptors cause the internal urethral sphincter to open, and that's what causes it's called a micturnation reflex. It causes us to need to use the bathroom as soon as possible. Micturnation means urinating. That's the biological term for that, is micturnation. It means the relaxation of the internal sphincter. Fluid management, how our body manages the fluids. So, of course, we know that water is essential for nutrient transport and waste removal, heat distribution, and chemical reactions. We drink water, ideally, but our fluid is constantly being lost through the skin and through breathing, through urinating out our waste, and through number 2. And food and drink, and also water is produced through the process of breaking down nutrients for ATP. So we can get water that way as well. And the fluid management is controlled by the hypothalamus. So when we do get dehydrated, there's a cascade of reflexes that happen. Our saliva, the amount of saliva we have decreases, which causes a dry mouth, and that's what stimulates our thirst to make us thirsty. So that's important to know. But drinking a lot of water helps, but what's more important is how the kidneys regulate the water that we already have. So we're going to be talking about that. How do kidneys regulate our water? There's constantly a process of us bringing water into our body, and that water going back out because we need to rid our body of waste materials. The hormones that are involved with regulating the amount of blood that we have, because how much blood we have in our system is dependent on how much fluid we have in our system. When blood pressure or blood volume decreases because we don't have enough water, the hypothalamus starts to release a hormone called antidiuretic hormone. And that increases water reabsorption and reduces urine secretion. Antidiuretic hormone goes to the kidneys, and it tells the kidneys, keep more water because we need it, or else we won't be hydrated enough for our bodies to do what they need to do. Another thing that happens is aldosterone is triggered to release from the adrenal glands, which makes an enzyme in the kidneys called renin start to be produced, which increases sodium retention. So it triggers the sodium to come out because water is attracted to sodium. So water will stay in the kidneys so that it can be reabsorbed into the bloodstream when the blood pressure or the blood volume gets too low. However, and so in this diagram, I have some happy little kidneys with the aldosterone and the ADH. So it's like, blood pressure's going down. So the kidneys are like, I'm going to increase my retention of water. So I'm going to increase how much water I'm putting back into the bloodstream after I filter. And that's why our urine can be darker sometimes. It's because we have our body's trying to hold on to more water. And so it gets darker because of all the toxins, all the waste products that end up in the urine or at a higher concentration. Now, if blood pressure becomes high, because of hypertension, things like that, the kidneys will increase urine output to decrease that blood volume so that the pressure will go down and we're not risking hurting ourselves. So what kidney function does to regulate those electrolytes and the pH of our bodies is it does regulate those ions, sodium, potassium, calcium, phosphate, by deciding which ions are going to be released and which ones are going to stay. So it keeps us from having too many or too few electrolytes in our body. And of course we know that hydrogen ions and bicarbonate both are ions that can regulate our pH. So it helps to regulate that so that our blood pH is in that just right spot for greatest functionality in the rest of our body. And then finally, waste removal from the kidneys. It removes urea, ammonia, uric acid, bilirubin, which is a waste product of red blood cells, and also drugs, toxins, and when we have too many vitamins, the kidneys will filter those out so that it sends them on down the line and they aren't in our bodies anymore. And then finally, kidneys do secrete a couple of hormones. One is calcitriol, which is the active form of vitamin D. So it does secrete vitamin D. So you would think vitamin D would not be would not be a hormone because it's called a vitamin, but it actually is a hormone, not a vitamin. And then erythropoietin, which triggers hematopoiesis. Erythro means red. Poietin has something to do with the production of red blood cells, production of cells. It stimulates red blood cell production. Thank you, kidneys. Okay, so how is urine formed? We're going to go through the process. First thing is the blood is cleaned through a process called filtration to take out important electrolytes, glucose, amino acids, hydrogen ions, and bicarbonate. They're separated from the water and the waste products, and they get reabsorbed, and then the urine is secreted into the duct. So let me just go over this real quick. The way that it happens, imagine that there's blood vessels all over in here. My cursor is pointing here at this Bowman's capsule, and I'm gonna go through it again in a minute. So just engage with this information lightly. Just listen for it right now. You don't have to memorize this yet. So this Bowman's capsule, which is also known as a glomerular capsule. I have a really hard time wrapping my mouth around that. That's the other image of it is right here. It's a bubble where the arteries come in, and then there are veins that wrap all around the rest of this nephron. This is the functional unit of a nephron, and they will absorb the nutrients and the water that our bodies are supposed to keep to put back into the bloodstream. And everything that our body doesn't want goes through this hairpin and goes down into the duct and out the ureters. So filtration is the filtering part where the good stuff that we want to keep gets pulled out. And then reabsorption is reabsorbing the water, and secretion is putting the fluid that we don't want down into the bladder. This is a very simplistic image that has those landmarks marked out, like the Bowman's capsule and the loop of Henle and the distal convoluted tubule. The convoluted tubules are all these squiggles where there's going to be more surface area for filtrate to get through. That's why it's important that there are so many squiggles in a nephron. It's because the structure of a nephron is just one single cell, epithelial cells, and there's filtration happening constantly all the way through this nephron. Okay, so the first step I'm going to go into a little bit more detail is filtration, and that's where the arteries go into that Bowman's capsule. Looking back here again, that bubble right there, boop. All of these arteries are going inside. Here it is right here as well. There's a couple of terms that you need to know, and those are afferent, which means before arteries, and efferent, which means after arteries. The reason that there's a difference between afferent and efferent is so that you know that this bigger arterial tube is going into that capsule, and it's because it's so much bigger, there's a higher pressure, which forces those filtrates out into the glomerulus. So it keeps, you see how the blood vessels, the efferent blood vessel, the vein comes right back out. So it's keeping the solids and it's pushing the liquids out into the duct. And here's where the rest of that duct goes. So it's going squiggle, squiggle, squiggle in this image. It's going around and around and getting filtered and filtered. And I just wanted to point out also that you see these veins that are all over the nephron. It's so that that filtration, absorption, and secretion can filter back and forth very easily because there's so many vessels wrapped all over in there. Okay, let's see. Talked about the afferent arteriole, which is going in, efferent is the arterial going out. And then the peritubular capillaries are the capillaries that wrap all around the tube of the nephron. Pretty easy, right? Peritubular. So the liquid part goes down the yellow, and all of the blood and the important nutrients and electrolytes that we want to keep are being diffused back into the renal vein. The next step, as I was saying, was reabsorption, and that's 97 to 99% of what goes into the nephron is going to be reabsorbed again, except that our body has removed, or the nephron has removed, the waste products. So all the glucose and amino acids, ideally, are being reabsorbed. 2/3 of the water is being reabsorbed. Many of the electrolytes are being reabsorbed. And what's remaining is tubular fluid, which ends up going into the collecting duct. It says reabsorption happens most in this area, but it can happen all along here. And the same with secretion. The back and forth can happen all throughout the nephron. As it goes, the fluid goes in, wraps around. So it needs all these squiggles so it will slow down and there's more surface area. Then secretion, that's the final step. That's where everything that our body doesn't want anymore gets taken out of the blood and put into that renal tubule to end up going down into these areas called the calyxes, into the renal pelvis, and out the ureter. So it eliminates ammonia, urea, when there's too much hydrogen ions or potassium ions, and medication waste or toxins. So it occurs along the entire tubule, just like reabsorption goes into the ureter. Now, a normal composition of urine is 95% water. There are pigments from the bile and the hemoglobin that have broken down, so that's why it's yellow. Nitrogenous waste, it gets eliminated out. That's urea, ammonia, uric acid, and creatine. These are all from the cellular processes. And then electrolytes that end up coming out in our urine is sodium, potassium, chloride, sulfates, and phosphates. The average pH of urine is slightly acidic at 6.0. That's why we need the mucous membranes in the vessels along the urinary tract to keep that acidity from damaging them. And for people who have a high protein diet, high meat diet, their urine's going to be more acidic, and for people that have a more vegetarian diet, their urine's going to be more alkaline. Okay, so that's all the information that we need to know. Now it's time to get on with our MBLEx-style questions. Here we go. Which structure is primarily responsible for storing urine until voluntary release is possible? What structure is going to store urine until voluntary release is possible? A, renal pelvis. That was the part where, in the hilum of the kidney, where a lot of that filtrated urine is collecting before it goes down the ureter. And then, does the ureter store urine? No. The renal pelvis doesn't store it? No. The bladder stores urine, and then the urethra does not store urine. That's just the part that we have, the sphincter that we have that keeps us from urinating at the wrong time. So the answer would be C, bladder. The bladder serves as a temporary storage reservoir and expands via rugae and smooth muscle layers to hold urine until micturnation is appropriate. The ureters simply transport urine, while the urethra is the final exit passage. The renal pelvis collects urine within the kidney but does not store significant volume. Next question. Which situation would most strongly stimulate the release of renin from the kidneys? Renin, that was the enzyme that gets released in the kidneys, right? So what would stimulate that release of renin? A, elevated blood sodium levels when there's too much sodium. It has something to do with sodium, doesn't it? B, increased renal blood flow? Increased, that would not. Let's see. C, decreased blood pressure or renal perfusion. Ooh, I didn't hear that word before. Or D, high blood calcium levels. So calcium doesn't have any, we weren't talking about calcium at all in here. Decreased blood pressure, I know, has something to do with the release of renin, because renin helps our body to absorb more water by increasing sodium. So I'm going to go with C, high blood pressure, and maybe we'll find out more about what renal perfusion is. Explanation: renin is released when the kidneys detect reduced blood pressure or reduced blood flow through the renal arteries, signaling that fluid volume is insufficient. This initiates the renin-angiotensin-aldosterone system, RAA, which increases sodium and water retention to restore blood pressure. Elevated sodium or calcium does not trigger renin release. Next question. Which process best describes the movement of ammonia, medications, and excess ions from the blood back into the renal tubule? Okay, so a process that describes how ammonia, medications, and ions move from the blood back into the renal tubule. Okay, so we have filtration. That's when we have stuff that gets taken out of the afferent blood vessels, and then the afferent blood vessels pick it back up. Then we have reabsorption, movement back into the renal tubule. Let's see, and secretion. I think that if it's going into the renal tubule and not into the blood vessels, the renal tubule is the tubule that connects with the renal ducts, the collection ducts. So I think that secretion would be more involved, because secretion is the last one. Concentration isn't the answer at all. So I think secretion is where fluid goes into a collecting duct or the renal tubule. Let's find out which one is right. Is it C? Yay! Secretion selectively moves substances from the peritubular capillaries into the renal tubule for removal, allowing the kidneys to eliminate drugs, toxins, and excess ions. This process works alongside filtration to fine-tune blood chemistry. Reabsorption does the opposite, returning needed substance back to the bloodstream. So that was the key thing, was that it was renal tubule, which is stuff going out, leaving the body. Last question. Which component of the urinary system is responsible for preventing urine backflow into the ureters during bladder contraction? Do you remember this part? We have A, internal urethral sphincter, B, the trigone, C, urethral openings acting as one-way valves, or D, external urethral sphincter. So the internal and external urethral sphincter are not attached to the ureters. But what is attached to the ureters is the urethral openings. So remember, we were talking about how they were the ureters attached to the bladder at the base of the bladder, and they're set up at an angle so that they become one-way valves. So the answer is C, urethral. I'm going to try it again. Urethral openings acting as one-way valves. Explanation: the ureters enter the bladder at an angle that crosses their openings during bladder concentration, functioning as built-in one-way valves. This prevents painful and dangerous backflow. The sphincters regulate urine outflow, not backflow. Now that's going to be it for us for today. Thank you so much for watching. Make sure and get your PDF. We're getting close to the end here. All we've got left is the reproductive system, and then we're going to talk about, of course, energetic anatomy. And make sure and subscribe if you're not already so you can be in the loop about future videos. And